Welcome back from the break. Now let's go to the Information Ministry now for a Meet the Press session with Health Minister Kweku Ejiman-Menu, who is speaking right now.
So those of us who interact with our little communities we left behind to travel to Accra to make ourselves what we are here, if you perchance get back to the rural communities, you might encounter some of our workers visiting our siblings that we have left behind, looking at them to make sure that they also are getting their fair share of the health services that we provide. Presently, I want to mention a few of the ongoing construction projects or development of health infrastructure that we have on our hands. We're constructing and equipping 10 polyclinics just in Central Region alone. We have one at Brewer, and we have others. I wouldn't want to mention all of them. I think you will see them on the slide. These are in the Central Region. Besiase, Gumwade Rampong, Akumfude, Echi Sunkwa, Odobin Jamra, Brewer, Ekumfi Nakwa, Mankron and Bimpoeja, then Gumwa Posing. These are projects that are ongoing at various stages of completion. In Greater Accra, we are developing and equipping 5 polyclinics: Madenta, Ashaman, Botiano, Ujumai, and Sege. We're also doing a package of 8 hospital projects. First 4 of the 8 hospitals are scheduled to complete in April 2018. You can find them in Wa Regional Hospital, Tema District Hospital, Tepa, Nsoko in Buahafo, and then Atomic Hospital in Greater Accra. That hospital was supposed to have been located in Medina, but because of land issues, we had no other option than to relocate to where we could find land without much litigation. The other 4 are scheduled to be completed in December 2018. We also have another package of district hospitals, 7 of them, located at Dodua, Shayo Suluku, that is 100% complete. We have Kumawu, Abetifi, Formina, Sekendi, Takoradi European staff accommodation in that area, and Garu in the far Upper East region. These are at various stages of completion. We're having some challenges with work ongoing because of some little issues with how much has been paid to the contractor and how much work has been done. And when we try to do reconciliation, it's not clicking that much. So we, together with Ministry of Finance, are trying to do some little auditing value for money to see if what we have paid so far has called for value for money on the projects that is there. But we are not going to stop it. So we will recommence and continue to complete these projects. We have another 5 district hospitals packaged. These can be found in Sola, Tolong, Somenya, Bupe, Weta, and again a polyclinic in Bamboy. Cabinet approvals have been secured for these projects, and we are at the moment doing value for money auditing. When we finish, we will award these contracts and work will commence. We do a lot of disease prevention and detection and curative issues. And at the moment, we are trying to accelerate the rate at which we do TB case detection. This project was designed to enhance TB control program to achieve WHO stop TB target of 70% case detection in Ghana by 2015 and lower the burden of TB. A total number of 52 radiographic systems for 48 hospitals nationwide has been provided. Quite recently, 4 portable radiographic systems, of which 2 permanently installed in specially designed TB screening vans for the National TB Program for outreach activities. And I think we handed over these 2 mobile vans to the Director General and his staff in Ghana Health Service not very long ago. We have installed some of these equipment in some of the hospitals that we have, and we can mention Navrongo District Hospital and Wichel Hospital project, CB project. Bekwai District Hospital. The project started, went to a certain stage, and came to a halt. Government has now secured a loan to fully complete the Bekwai Hospital project. The project scopes include the completion of the remaining civil works, supply and installation of requisite equipment, provision of training and maintenance. The ministry at the moment also is awaiting for the final value for money audit report based on negotiations with the contractor to enable the ministry to submit the supply contract to Parliament for final approval. And you can see a picture of how Bekwai Hospital will look like after completion. The ministry has also embarked upon an office house, the ministry, and a number of its agencies. We are facing very serious and to accommodate additional staff. Presently, we have agencies without accommodation. And offhand, I can mention Mental Authority, HIFRA, that is the Health Facilities Regulatory Authority, the Psychology Council, and a number. And even those who are sitting in the ministry itself. When you get to the ministry, you will see the afternoons when people are coming to us, how chaotic our place can be. But we believe by close of next year, we will have completed our office complex. Akachi District Hospital. The project is costing 12 million cedis. We are supposed to construct male and female wards, central supply and sterilization department, and laundry, a theater, mortuary, and a block of flats for Akachi District Hospital. Progress of work is about 70% complete. The ministry is in the process of securing funds to fully equip the hospital, as well as the provision of critical, mechanical, and electrical installations to give that hospital a very full complement of what all of us can conveniently call a hospital. Expansion of radiotherapy and nuclear medicine centers in Kolebu and Komfanochi. Civil and retrofitting works at Kolebu for simulator, cobalt, unique accelerator, and brachytherapy rooms have been completed. All equipment installations have also been completed for Kolebu. Civil and retrofitting works at Komfanochi for simulator room has also been completed. Simulator equipment has also been installed. LINAC and brachytherapy rooms are currently ongoing, and we have about 70% and 50% completion stage, respectively, for these 2 rooms. And you can see some images of the equipment that we are talking about. We've also went on to embark upon construction of a hospital, district hospital, and 5 polyclinics in the Western region. The project received approval from Oreo, that is the funder, who is providing a 35% grant, and the rest will be a loan component. Oreo has approved the process and has given the no objection for the ministry to sign the contract with the winning firm. I think a company has won the bid, and we will soon sign contracts for these projects to start. Phase 1 of the Bolga Regional Hospital is at 92.39% complete. Due to funding problems, this project also came to a halt. Equipment installation and training are yet to commence. Full complement of the equipment has not been secured yet, with a funding gap of $5 million. The $5 million will actually complete the civil works that we have yet to complete. And then luckily, we have now sourced for a loan of about $20 million. We have submitted documents for approval from Cabinet, after which Cabinet will approve. And as quickly as we get these approvals, we will then go doing equipment procurement and installation and fully complete phases 1 and 2 of the Bolga Regional Hospital. I want to believe that by close of next year, we will have taken our hands away from it and will have actually operationalized a fully fledged Bolga Regional Hospital. We are doing major rehabilitation and upgrade of Telemedicine Hospital Phase 2. The cost of this project is close to about €38.5 million, and the completion of this Phase 2 will bring the bed state of the hospital to 800 beds from the existing 400-bed facility. Contractor is on site, and progress of work is about 55% complete. Discussions are ongoing for the development of a urology center under a PPP arrangement at the Kolebu Teaching Hospital. A joint cabinet memo will soon be submitted to Cabinet for consideration. And soon, probably when that is done, we will see the commencement of a modern urology center at the Kolebu Teaching Hospital. The Greater Accra Regional Hospital, the RAGE project. The ministry operationalized phase 1 of the newly built Greater Accra Regional Hospital at RAGE in May 2017. We are yet to commence construction of the phase 2. A memo signed jointly by the Minister for Health and the Minister for Finance for funding has been completed and submitted to Cabinet for approval. We are estimating a cost for the phase 2 of about $98 million. The phase 2 will focus on the following departments of the facility: outpatient clinics, specialized services, in vitro fertilization, caveat catheterization, laboratory, dialysis units, and what have you. We'll also add additional 200 beds to what we have existing at the moment. University of Ghana Medical Center. Plans are underway to operationalize the University of Ghana Medical Center after the completion of phase 1, which is still not completed. Efforts are underway to complete phase 1 for operationalization. A cabinet memo has been submitted to Cabinet for consideration to procure about $50 million for completion of the phase 1 and development of phase 2, which will consist of details that I'm going to outline. Neurology, pediatric surgery unit, VIP maternity care with assisted reproductive technology center, IVF and also daycare surgery, facilities for cardio and open heart surgery, additional facilities for the medical training, robotics center, commercial outpatient pharmacy, provision of substation to boost power supply, and staff housing. We're planning to do 30 number 2-bedroom apartments, and then a commercial morgue. And that is likely to begin and be the first base for health tourism in Ghana that was put in President Akufo-Addo's manifesto. Central medical stores. The ministry is now sourcing funds for the construction of the central medical stores. Efforts are very well advanced. The CMS fire investigation report has been submitted to the Auditor General upon his request. I think we were talking too much about central medical stores. Where is the report? Why are we not responding? So the Auditor General called for a copy of the report. And as we speak, he is finalizing due processes to conduct a forensic audit of the report. And when that is completed, he will advise and make recommendations And that is what government, I believe, will have no option than to take to implement. In the report that I saw, it is put in the report that there should be a forensic audit. And therefore, without forensic audit, I don't think much could be done. So work is not completed. And I think that is how, when he got the report, he decided to go that way. But he's taking his time to do open competitive bidding to select a consultant who will do that work. And then that is causing us some little bit of delays. But I hope that soon or late, that will come to conclusion. Maternal and child health. The ministry is collaborating with the Office of the First Lady for the construction of the new mothers and babies unit at Komfo-Anokye Teaching Hospital. Progress of work is about 95% complete, and the project will be commissioned in January 2018. The ministry is also aggressively pursuing the completion of the suspended 1,000-bed mother and child block at Komfo-Anokye Teaching Hospital. We are looking around enthusiastically, sourcing for funding to see how we can apply that to complete that project. Retooling health facilities for maternal, newborn and child health services. Under the Millennium Acceleration Framework, and in collaboration with our development partners, a lot of essential equipment has been procured and deployed across the country, which include 20 200 kVA generators for needy facilities, 212 delivery beds, 200 delivery sets, 51 theater tables, 21 phototherapy machines, 10 incubators, 45 blood bank fridges, and 70 anesthesia machines. Sooner or later, we may have to hand over the anesthesia machines to the Ghana Health Service to facilitators to distribute these to the places that have been put on our distribution list. Telemedicine scale-up. To improve access to healthcare for people in remote areas of our country, and to strengthen the referral system, 5 teleconsultation centers have been established in collaboration with our partners. These centers are managed by experienced nurses, midwives, and doctors who provide medical advice to help professionals who need support. Regions have developed roadmaps for scale-up, and the regions that we will initially roll out will include Central, Eastern, and Ashanti. An integrated health management system has been piloted successfully in the Central region. 25 health facilities in that region are now using the health management information system that we have introduced in the facilities. Capabilities of this particular facility is not just managing patients and keeping their records and directing them and doing computerized systems in the hospitals, but that includes some capacity to do what we call biosurveillance to improve early detection of outbreaks. And that was launched about 3 days ago at the Trauma and Accident Center Hospital at Winneba. Service delivery. Facility-based clinical care services. To improve efficiency and to provide safe environment for client care in our facilities. We do hospital information systems development and deployment. We are pursuing these things. Like I said, Central region has been piloted, and I think things are running well now. So hospitals like the Cape Coast Teaching Hospital itself, the Solpong Hospital, the Winneba Hospital, the almost everything in there, including some chip compounds in Central region, as we speak, are running and they are talking to each other. So that if you attend hospital in Winneba, and tomorrow morning you find yourself in Solpong, and you want to go to hospital there. When you go, they can access your records, your folder that is sitting in their records in Winneba at Sopon, and that will help the consulting doctor to look at your history to be able to take very good care of you. Human Resource for Health. A committee was set up to review and advise on restructuring of the pre-service training in the health sector. Reports have been submitted and recommendations have been implemented. We're doing rationalization of admissions to improve quality. That is where we introduced the quota system, and there was a whole sort of political criticisms on that system. But we scientifically know what we are doing, and we didn't budge at all. We did online admissions this year for all the students we put into our health training institutions. The little good thing was that admission fees were reduced from 160 Ghana cedi to 100 Ghana cedi to facilitate our young people to have access affordably to these training institutions. In the process this year, we have recruited and deployed close to 16,602 health professionals for this year. This includes nurses, medical officers that we all call doctors, allied health staff, and others. Normally we have ancillary staff, those of us who do the administration, accountants and health administrators, and those of us cleaners and laundry people. We are all in there. And these are the people we have managed to recruit this year. Come next year,